Okay. Thank you, people, for joining. I'm sorry about the delay. We'll see if we can't get this all covered. Zoom just has not cooperated with me this morning. Not being kind, let me put it that way. I'm Nancy Phillips. I'm the coordinator of the Illinois Family Resource Center. And the webinar we're doing is the Family Recovery Journey, Recognizing the Grief Process. This is not totally new, although we've added a new twist to some of the things that we're doing with this. It just seemed like such a good time to go ahead and start talking about some of the things around grief and moving forward and understanding what's going on, because we're just in some really trying times, not only in our country, but worldwide. And we have a lot of littles that are struggling with some of this too, especially coming out of the pandemic. So we're going to go through some information here, put things in chat. I have Zach, who is our administrative assistant. He's on here, and he can be watching the chat and see what's going on. You will be getting emails from him. And if you have any questions around things, be sure and link in with Zach. There he is. And here we go. The Illinois Family Resource Center. Sometimes change happens at an hour at a time. This is our website, which I will tell you just a little more about. This is my email address. It has changed a couple of times in the last 2 years. I can still get emails at any of the old ones if you have them, but this is one that Central East Alcoholism and Drug Council has rebranded to the Our House for all the facilities that we have down here in Central Illinois and Charleston, Illinois, and all the surrounding counties. Our house holds the state contract through the Department of Human Services, the Division of Substance Use Prevention and Recovery, better known as SUPER to most of you. They hold, our house holds the contract. And what started out to be maybe a 2-year project with some federal funding and kind of looking at the issues around families and how do we support families living in the chaos of substance use disorder, mental health, and now we, of course, have added gambling, is now going into its 9th year. And we have growing, we're expanding. Zach came on this fall as the administrative assistant, and we have a person up in the Chicago area. Her name is Christina Banda. Some of you may have met her through other avenues. And what's really exciting for us is she's going to be doing some things in Spanish for us. She's taken a lot of the webinar PowerPoints and stuff, converted those to Spanish. She will be offering those throughout the Chicago area, especially for trainings and meetings. And she will actually be doing some of the webinars online for us as we do this. We provide information about resources for human human service providers, parents, significant others, communities. Do a lot of work with Ross councils. I especially have, because I've been involved with it in one way or another basically since they started. And we do that through a variety of methods. We have website postings. Go to visit our website. We just keep expanding the services we have on that. And Zach's handling a lot of that. You can register for our webinars on there. You can watch. We record the webinars and they are posted on there, the ones for almost the last year. We now are doing a newsletter that Zach will be sending out a copy of that. Zach, I'd like for you, when we send out certificates, send out the newsletter to them, and so they know to go online and register for that on our website.
Absolutely.
Yeah. And that'll kind of keep you updated. And it also, we want the newsletter to be an opportunity for you to share with us about what's going on. What are the stories in your community that might be shareable and that can make them the motivation that we need in our field right now work better. We have a Facebook page. All of us contribute to that. I think that starting today, we're going to be adding some things to that in Spanish, which I find exciting. Webinars, we're doing monthly webinars, sometimes more than one. It looks like coming up this spring, we could be doing 2. And I'm not doing them all. To start with, that's kind of what I was doing. And last year we brought in Pam Wall, who did a couple of them. And this year we have, just as of today, I've been lining people up. We've got, I know, 2 outside people, because we want to expand what we do, share other people's view of what's going on. We can provide technical assistance and facilitation. We can do individualized in-service presentations, either in person or through Zoom, hopefully when Zoom cooperates with me. And the difference between those and webinars is depending on where you are. If you're a Ross group, if you're a super provider, a mental health provider, a child welfare worker in an office or in a group, if you see topics that you want that have to do with substance use disorder and the impact on families and children and communities, any of those things, we can tailor those through an in-service to specific groups. And our webinars carry CEUs for them through IADAPCA, which is the Illinois Certification Board, and also through the state professional registration, we have CEUs. We do conferences and exhibits. We just came off of the Prevent Child Abuse Conference last week and handed out probably 200 to 300 pieces of material around what the services are, what the impact is. The other thing that we're doing that's really exciting is we have networked with the National Association for Children of Addiction. And we, for the last 2 years, have provided training to teams, and the training's done virtually through NACOA on the Celebrating Families curriculum. And this year we have budgeted to do 2 teams in Spanish, and Christina will be working with that and marketing to get those teams together. The other thing we're doing this year is they have what's called the Children's Program Kit, which is materials that can be used in a number of ways, you know, about anywhere that there's children and somebody working with them. And it's looking at offering children some tools to know that they're okay, that they aren't alone. And we will be training 10 people this spring. We are still open to people. It can be used in a lot of different ways, and that's what NACOA is going to do. We will do an orientation in March of an hour, and then you will have on-demand virtual training on different ways to implement that into your groups, whether it be community groups or school groups that are doing groups for their children that they know are struggling, or providers that are out there doing things. So let us know what you want, and we're going to be putting together a form that we'll send out to you, and we'll do up to 10, and we provide the curriculum. So that's a definite advantage. And we're also doing a lot of services in Spanish and English. Since we had a little bit of a delay with Zoom and then my computer not wanting to put it back up right, I want to just get through this information and get to our topic. But these are the next 2 webinars coming up. I will be doing one later this month. Holidays are coming, the value of traditions. It's a good time to look at traditions, even though we need them year round. And we'll talk about that. And we'll talk about the impact on communities and families when there's substance use disorder and other issues going on in the chaos. And then Christine is going to do the same webinar for us in December in Spanish. So here are the 2 flyers. And we will be sending those out with you with your certificates from this training. So now we're going to get busy, knowing that participants will, and actually I should have changed that to my wish for you, let me put it that way, is to review the impact of substance use disorder and mental health on family functioning. And you can include gambling with that. Explore grief issues and lifestyle changes that are often present in the family and communities. Generate resources for moving forward in health, and share strategies available for families, especially children. We're going to take a look at that because of some of the things that are going on in our environment. We really have to be looking at what we're doing with our children. I didn't do much introduction for myself. I come from 4 generations of substance use disorder at different levels. I am the person with lived experience as a family member, we'll put it that way. And I have experienced grief that's associated with this. So, been in this field for over 40 years, still here, and I love it. And I love the people that are part of it. So as we look at grief, one of the reasons that I like doing and addressing grief is when I was coordinating outpatient services. I've worked at the state level with prevention. I've done trainings all across the United States over the years, but some of my best times and most meaningful times were doing direct service at this local, excuse me, at this local level. And I coordinated outpatient services for a number of years, and we worked very closely because we had the contract with DCFS for this area and did a lot of work with them and the families. And what I saw was a lot of grief. And it's been, what, 15, 18 years since I've done that. And we weren't really addressing things in the field so much as grief. It was all, these are the things, the outcome of what then we were calling addiction, drug addiction, alcohol addiction. Our terms have changed, our research has changed, thank goodness. And we're really moving forward. But it wasn't addressed so much. And I couldn't even find a lot of resources of how do we separate some of what we see going on with both our clients and then their families that to me looks like grief. And I wasn't far wrong. Now there's a lot of people that, matter of fact, today I had 2 notices of some stuff that was going to be done on grief, especially with the holidays coming. So there we are. What we want to look at is when there's trauma and things that might create settings where there's grief is what's the chaos like for the family? If they're living with substance use disorder, mental health, gambling issues, what's that chaos like? And how does that look like grief signs and symptoms? What are the family members feeling? What are the family fears? And then what are their survival skills? And that's really important when we look at things around grief. What are the survival skills? If we've identified family questions to answer, where are those feelings of loss fitting and for who? And this is just kind of a quick overview of persons experiencing substance use disorder and co-occurring disorders. They have a feeling of grief, and we'll talk about that in just a minute. We had a lot of issues come out of the 2022 pandemic, both with our children. We know that we're having a lot of mental health issues, especially with our young people. Where you've seen more of an increase of overdosing. Schools are doing training on being on top of mental health and watching for their students. Life change, not only for the adults, but for our young people, for our teenagers, and our littles. Family lifestyle change, which a lot of that came out of the pandemic, a change in jobs, a change in the way you live, a change in relationships. Someone that's incarcerated, especially if it's due to substances and drug issues, we have feelings of loss, overdose, and death. We know that's going up. Loss of a job. How do you live without an income, without a place to go? So think about what else. I also want you to think, I wish I was doing this in person. I would much rather be doing trainings in person, but we can't do statewide trainings and can't reach the people on a personal level that we can through Zoom. And we've got quite a variety this time. I think it's great. Think about the feelings and behaviors you've experienced when you're working with people impacted with SUDS and mental health. And put some comments in chat, and I'll have, I'm going to go ahead because I don't want to get too behind, but it all fits together. Put some of your responses in chat, and I will have Zach share those as we come up with them. When we look at, this is going to be probably a lot of what you share. When we look at the family chaos that comes as a result of all these issues going on in the family and in our communities, there's a lot of worry, fear, frantic times, shame. Here we go, shame, guilt. as you look down through these, the stigma's just popping out. Right now, that family chaos, one of the biggest things is probably stigma. I don't want anybody to know. I don't want to share this feeling. We've got to come out of that so that our communities can get better, so that we can handle families being well. The Family Resource Center, basically our message, my personal message, having gone through 4 generations of this, is that families, members need to take care of themselves. Communities need to come together and be strong. Take care of yourself. Even if the person experiencing these issues isn't willing or ready, you're not going to be healthy yourself until you take care of yourself. Your recovery comes first. And then you're there as support for the people as they enter their recovery journey. But as we look at that family chaos, all the sadness, loneliness, exhaustion, intense focus, breakdown in communication, keep these things in mind as we look at what are signs of grief and things that are going on. Zach, if we get any comments to share, let me know.
Got a few of them.
Okay, throw them out there.
They were saying loss of control, resentment, acting
Yep.
out, defensive and shut off, and adult children cutting off their parents.
Absolutely. Yep. That all fits in there.
Yep.
Okay, now we're going to just keep in mind what we generated around working with families with those issues. And then let's take a look at grief. Grief happens as a result of many life experiences. Many people associate grieving with death, which is understandable, but often the most intense type of grief is not due to death, and any loss can cause grief. And I think we're finally recognizing that in our communities, in our homes, in our professions. Grief typically occurs without rituals and social validation due to unconfirmed nature of the loss that has happened. A lot of times we don't even realize that's what it is. Substance use causes grief. Relapse causes grief. Missing people. Oh, especially during the pandemic. We were missing people. We needed people and we didn't have them. Military deployment. Canceled milestones and events. We saw a lot of those. Oh, weddings that didn't happen, or weddings that happened with 2 or 3 people there rather than the big celebration and event that you planned on. Emotional detachment, divorce, memory problems. We keep hearing more and more about people struggling with dementia and other types of memory problems, chronic mental health problems, miscarriage, infant death, incarceration, parent and child separation. We know, and I do trainings on this, and we know that kinship care, not just grandparents raising grandchildren, but kinship care of a family member stepping in and taking over that role is increasing. On Wednesday, Generations United is going to release their new report from last year and they have a breakdown for every state. If you aren't familiar with Generations United, by all means, go there. It will give you so much information, and they break each state down specifically in their yearly report so we can get a good picture of what it looks like in Illinois for our children and our kinship care people. And just alienation as a whole causes grief. But the thing that I think we need to look at, no one tells us about grief. Grief is isolating. There are a lot of secondary losses. I'll give you an example. We talk about someone that is incarcerated due to drug charges or similar things and has children. The parent of that person has a loss. The person that's incarcerated definitely has a loss and may grieve that. The children that are impacted, the parents, the children, you go on down that, there's a lot of secondary losses. The pain of grief can hit unexpectedly. I have lost my 2 best friends due to health reasons. One in 2000, or one in 2021, no, 2001. And then I lost another one 5 years ago. I lost my father 4 years ago, who probably died of his alcoholism, highly functioning. And one reason this hits me over the holidays, and I like to share that we need to get through the holidays and think about our grief and manage it, is because he died on December 22nd and was buried on Christmas Eve. I handled death well, thank goodness. He was only 53, but every now and then something will hit you unexpectedly. You'll drive by something that makes you think of that person, and it just kind of goes boom. I had that happen yesterday. He's buried out close to where I live, and I was going past there, and I thought, I've got to pull in. I haven't been here for several years, because I had that sudden unexpected feeling of loss. It was okay. I managed it. I went up, I said hi. I just kind of processed it for a minute and thought about today. And I think that may be one reason it hit me, was I knew I was doing this today. Grief can be exhausting. You don't sleep. The memories can be overwhelming. You can experience many feelings all in one day. And sometimes it lasts a lot longer than you expected. It changes us. Definitely does. The grief brain is real. The way your brain changes function, the way it protects you, changes your behaviors for a while. You also realize you lose your patience. A lot of physical issues. Some people really struggle physically. It's disorienting and it's transformative. And then we're not talking just about death. We're talking about people losing what has been their way of life, just about anything that's a loss. Even if you start looking at some examples going back to the pandemic that I saw pop up for our teenagers, and it happened here in our area. I'm in central Illinois, and I know a lot of the schools, graduation didn't happen. You have worked hard for that. And suddenly that milestone in your life is not as recognized. It's a grief. And it's tough. Grief is an experience that is often not recognized, especially by us that have a loved one with a substance use disorder. We want to blame it all on the substance use disorder. And yes, that is a big issue, but the result, the grief, kind of gets lost in the mix. And I think that's why some family members really struggle with moving into their own recovery journey. Grief is a natural reaction to loss. As substance use disorder, mental health issues expand, continue, recovery isn't happening. It's tough, because you get pulled along with it unless you know that you can take care of yourself and start focusing on your own work. We often do not realize why we are grieving or recognize that we are feeling grief. And I think, we think that if we so associate grief to death, we don't understand that there's a lot of other things that create that. I saw a couple of these that I kind of like to put in here. Sometimes I just have to stop, close my eyes, hug you, even if it's only in my mind. That can be for someone that's incarcerated due to their substance issues and legal issues that can be the child that you raised that is now into substance use disorder, and you have their children. Been there. I am one of those grandparents that raised grandchildren, and I did 2 different generations, never imagining in my life that would be part of my world, but it was. I think that's kind of what happened to me yesterday when I made a stop. Just stop, close my eyes, hugged him, and moved on. And that's good. That's healthy that you can do that. One of the things when it comes to grief that I want to share, and I talk a lot more about this when I do kinship care, but is looking at the relocation stress syndrome. It's really a grief process. It's physical and or psychological. It is created from a disturbance of transfer from one place to another. So if you are a family member that's taking on care of another person in the family, be it a child or a senior that needs care and needs to move with you. You need to move them into where you are. They need to move them to a senior care facility, or you're taking children into your home because the parents can't take them in. Relocation stress syndrome is very real, and we're just now seeing more and more about it. And for many, it's not really even that you have to relocate, but it's that change and that shift in your life that's a relocation. But also for many, it is physically moving. And that move is often just a beginning. And then you have to adjust, and understanding that adjusting and the grief that goes with it is just the beginning. I looked up some more stronger definition, and it's sometimes called transfer trauma. RSS is a set of symptoms that occur when an individual moves from one environment to another. And there's definitely, even if it's a positive thing, there's often grief that it has to happen. Symptoms can influence our behavior, our mood, our physiological well-being, as well as our psychological, certainly. Anyone at any age can experience these symptoms, especially from a child moving to a new home or a new school. So as we're looking at a lot of what happened in the pandemic, a lot of our grief issues are very much associated with relocation stress syndrome. Experiencing the loss of an individual is tough, and each loss that an individual experiences is their own. However, there are some symptoms that you may share. So oftentimes when there's a personal loss, especially as someone got incarcerated in my family, I know that my teenagers causing trouble at school and experiencing problems because they're drinking and et cetera, et cetera. There's shame. When we look at what we call the rules of families, don't talk, don't trust, don't feel, those 3 old guidelines for families, that kind of all ties in with that personal loss. That goes with grief too. There's sometimes often very much a sense of shame, especially if it was an overdose death or an overdose, and even if they survived, they don't want people knowing, because there's that stigma that's attached. We need to share our stories, get rid of the stigma, and let people know they aren't alone. That sense of hopelessness, intrusive racing thoughts, anxiety, depression, anger, irritability, confusion, preoccupation with the thoughts of their loved ones. This also fits with the family chaos behaviors and feelings. And these are all survival skills. Some of them depends on where they are on that continuum of unhealthy to I'm getting better and moving forward in a healthy way. You can make that continuum and actually work with people on that. Where are you on this continuum? These are skills to work from one end to the other and go from unhealthy to healthy. Oftentimes there's difficulty committing to decisions, and sometimes it's because you don't know what's out there that you can use to commit. Inability to move forward with everyday tasks. It's like frozen in time feeling. And sometimes it goes back to when we said, all of a sudden it'll hit you. Something you didn't think about is going to trigger in your mind. Oh, that was so-and-so's. We did this. That hurts. There's emotional overwhelm, frequent crying or outbursts. That's not uncommon. Insomnia, difficulty accepting the new family role. What I can share with that is my father died at 53. He had some high blood pressure, heart issues, but he was also alcoholic. Highly functioning, except professionally highly functioning, highly functioning within the community, but his alcoholism took its toll on his health, and it took its toll on our family relationship. But when he died, a month later, my mother, they were divorced, was diagnosed with cancer, terminal. She was only in her early 50s too. I suddenly, as the oldest child, knew I had a new family role, and that was overwhelming. That was probably the most overwhelming thing. How do I take care of my children and my marriage and my relationship, because my husband was new in recovery? And how do I be there for my sister, who had nobody else but me, basically? She had her family, but, there was just us out there. And a lot of times, relationships get sabotaged when there's been a death in the family. And it's tough. Another thing that I think is very important to realize it when you're working with families and your actual people that are experiencing substance use disorder and mental health. When the family focus has revolved around the substance use disorder or co-occurring disorders, we, being the family members, often experience a sense of loss, and it's really a sense of loss of focus as the chaos lessens, as our family, as our person that we love is getting better, is in their recovery journey, is doing what they need to do. Suddenly, the focus of all the chaos in our family lessens, their recovery begins, but here's the family still out here not knowing what's going on, unless you're taking care of yourself, unless you are working on your own recovery journey. And that's one reason it's so important that families be included, at least be invited to be a part of the recovery process. Invite them to the support groups that are appropriate for them. Invite them in as a family member if you're providing services to them for treatment. Communities need to embrace. That's the wonderful thing about ROSC. Some of the I was involved with some of the early planning of ROSC. I was a mentor for a while, and I still do a lot of training and have connections with them. We've had several ROSC groups go through our Celebrating Families training to provide stuff in their communities. As we look at the recovery-oriented systems of care that focus on creating an environment that's healthy for recovery for family and people that are actually experiencing SUDS and mental health recovery, it's great, because if we can get them the support, then that change of focus as their loved ones getting better, they can focus on themselves and feel safe doing that. I love ROSC. Not only do family members feel grief, but as their loved ones may also have grief issues as they begin the recovery journey. And this is where I first thought years ago, when I was working in outpatient services, and I would be listening to reports from the counselors that I supervised. And I actually did a lot of groups because I loved doing that personal, knowing what's going on with the clients, that I was basically responsible for making sure they were getting the services they needed. I would hear what I recognized as grief because I'd been through it. And what they were missing and what they were feeling a sense of loss for was their friends. In other words, the environment that they were using in, and then the loss of their substance itself. And oftentimes they didn't have a replacement. That's why in their treatment was so important, where they were getting the tools that they need. And we talked about that missing and how they can start to fill that void, because it's a void they feel. And that's what we feel in any grief issue and any loss, is that huge void. Grief is different for each of us. There's no right or wrong way to grieve. There's healthier and unhealthier ways to grieve, but there's no right or wrong way. And it is. I lost both my parents when I was in my early 30s, took on that role of being actually the head of that part of our family. Lost two friends that were really what I would call my soulmate friends to health issues. And I grieved each one of them differently. And like I said, I'm very fortunate that I have had a healthy, basically pretty healthy process for myself. But there's no right or wrong way, and they're all going to be different. And there are healthier ways to deal with the grieving process. And walking through grief is tough as you move forward. It's one step at a time, just like any recovery is. I found this a couple of years ago when I started doing some training around grief. And it looks at those of you that are in the field and are familiar with the Jellinek chart of alcoholism. Yes, that came out, I believe, in the 40s. But just looking at that curve, I think it's a good fit, looking at normal functioning and to the return of a meaningful life. Normal changes when there's a loss in your family, whether it's incarceration or death, whether it's overdose, whether it's due to some specific health issues. Like I said, my dad's birth certificate said it was heart failure on his death certificate. And I'm going, it should have said death due to alcoholism related issues, because it was. And if you look at that, shock and denial, avoidance, confusion, fear, numbness, that first numbness is really what helps us take a breath and be able to move forward. A lot of anger, usually. 40 years ago when my dad died, actually a little longer ago than that, I didn't know as much about, a year later I joined this field, but I didn't know as much about all the chaos and family impact. I just knew how I grew up and knew the impact it had. And I didn't feel as much anger then as I might have at a later time, that it had a lot of influence on his death. But people feel that, and they also feel embarrassment and shame. We often go through some kind of depression and detachment. That's normal, but it's to what extreme it goes to that you want to be careful of, so that you can make a healthy movement through this. Overwhelmed, blahs, lack of energy, helplessness. Then as you start back up toward a meaningful life, toward dealing with the healthier side, dialogue and bargaining. Oh yeah, reaching out to others, desire to tell one's story. Now, when it comes to substance, depending on the situation, oftentimes when there's an overdose, when it's related to that loss and sense of feelings related to incarceration stuff, that desire to tell your story isn't as strong as maybe it could be to be healthy. We need to share our stories. Struggle to find meaning for what has happened. And then you get into acceptance, exploring options, a new plan in place. I think of the two people that I know that lost their child, their young adult, let's say in the ballpark of 20, to an overdose of heroin. Both of them went through a lot of this in a very strong way. They both still greatly miss their child, but they have moved forward, and both of them with a new plan. They've done foundations in memory of their children. They've been able to look at, how can I turn this around and make it something that's healthy for me to deal with? Doesn't mean I don't miss them. Doesn't mean that I don't remember them. Doesn't mean that I don't feel sad at times. But how can I turn this around so that I can move on with my life and have some meaning out of all of this? And I think that that's what we have to look at as we're working in a lot of instances where there's grief. A lot of different types of grieving. Delayed grief. Sometimes that's healthy, sometimes it isn't. We just put it off. You don't want to deal with what's going on. During the pandemic, there was a lot of delayed grief because issues of death, loss of jobs, those things were isolated and we couldn't move forward. That kind of goes along with the ambiguous loss that you see there. People couldn't, when someone was in the hospital, when someone was ill during this time, you couldn't have a family member. If you lost them, you weren't there with them. Both of those types of grief were really hard. And the ambiguous loss, the way it's put in here and the way the articles I've read about that, they definitely say it's not just due to death, it's to the events that didn't happen, the celebrations that you couldn't be a part of, those things that caused an extreme sense of loss that went along with the feelings of isolation that we were having, and fear. Exaggerated grief and complicated grief, neither one of those are very healthy. It's the exaggerated grief is that extreme emotional side where you really need to find some help. You need to work at how do you manage that? How do you work through all those, what you're using as survival skills in an unhealthy way? How do you get through those? How do you work through those? Complicated grief is very similar. Anticipatory grief is probably one that many of us have experienced with both of my friends and my mother. We anticipated that what was down the road, a lot of our grieving process happened before they were ever gone. Non-complicated grief, which I don't have actually listed on here, is a healthier way to move through things. It's a natural reaction in response to death or a significant life change. It's often very difficult to navigate, but it's knowing where to go to pull on your past experiences, look at your social support systems that are out there. What are the cultural practices that you can go to and use to move forward, and that they are used? It's looking at that. And I think that it's just not an easy journey. One of the myths, I'm looking at the time, so I want to get to the issues around children. So I'm going to kind of flip through some of this, because as I've talked, I've given you a lot of information about some ideas of working with adults that are going through this. The pain will go away faster if you ignore it. No, for real healing, it's necessary to face your grief and deal with it. Another myth is it's important to be strong in the face of loss. Feeling sad, frightened, or lonely is normal. And it's important that we let people have those feelings. Let them cry. For some reason, we, in a lot of ways as a society, and some of it may be culture, but I think that it's pretty much across the board. We have a tendency to feel like if we cry, it's going to mean we're weak. No, it's not. It's very healthy if it's at the right time and appropriate. Showing your true feelings can help you move through that process. Other than death, we may not realize that our feelings and behaviors are a part of grieving, and our journey to move forward may need to address it. I'm going to kind of flip through some of these given our time here, because I want to get to the information about working with children. But assessing support within your community is really vital for good mental and physical health. Go to your professional services, super providers, mental health services, counselors that are available in your community, faith-based groups. Go to your self-help groups, Al-Anon, Celebrate Recovery, Nar-Anon, Gam-Anon, SMART recovery groups. And the other thing that's important is hospice support groups. Most communities anymore have hospice support groups. That's not just for death, although I think that's part of our older belief system. Hospice groups have moved to be very supportive of dealing with all types of loss. At least in our area, they are. And I think it's important that we recognize that. Look at what those resources are. Recognize that you're not alone, even though you may feel lonely. Help the people you're working with do that. As Ross counsels, if any of you are on here, you can help that process in your community. As a community, how do you address people that are feeling a sense of loss? And a lot of it is being taken care of. If you have people that don't have a home coming into early recovery, if they don't have jobs, those things are all a sense of loss that they've had to grieve and deal with. So what can you do to help support that? If you're one of the person experiencing a sense of loss, face-to-face support yourself emotionally by taking care of yourself physically, and recognize the difference between grief and depression. Get legal assistance if appropriate. Gather documents and create a 3-ring binder. Yeah, our 3-ring binder now is probably a lot of it's on a thumb drive. But if you are as part of your loss or grief, if you're becoming a kinship caregiver, you need documents. and they need to be in your 3-ring binder, and they need to back up what's going on in that environment, because there's going to be a sense of loss and grief, but you need those documents so that you can verify that you're moving in the right direction. Take time for physical activity, make lists and do them. Find activities the whole family and community can enjoy. Have some fun, and for heaven's sakes, tell your stories. That's important. This is basically the same thing. I mean, to this day, when I want to go back to telling stories, I'm a big believer in stories. It moves us. My children and my sister's children, we get together, and most of them are teenagers and on into college now. My kids, of course, I'm a great grandparent. We get together once a year and we tell stories. We laugh about what our folks used to do, what we used to do as kids. That's part of that healthy remembrance. And if you start that, we've done that all along as we have addressed our times of grief and moving forward. That sharing of stories, some of them can be a little painful, but for the most part, there's fun ones that you can share too. And remember, you aren't alone, and find virtual support if you can't find local support. I believe the hardest part of healing after you've lost someone you love is to recover the you that went with them. And that can be in any situation. That can be if you're grieving through a divorce, if you're grieving through incarceration, if you're grieving through overdose, if you're grieving due to health issues that have caused loss. Recover the part of you that went with them. Okay, I want to talk in the next 8 minutes about children. Emotional stress can be harder on children because they understand less about the situation, from our littles clear up through our teens. Less able to control events, have less experience dealing with stressful situations, may not be able to communicate their feelings such as fear or anxiety, or don't know how to do it appropriately, especially when they get into their teens. A lot of our teens have lived through all the chaos of the pandemic, and so have some more of our littles. We had our great-granddaughter, guardianship of her during the pandemic, and she was 2, 3, and into 4. And that isolation showed on her. She was in Head Start, but Head Start was shut down for 2 and 3 weeks at a time. And when she went back, she had to wear a mask. So it's those things that you have to help them understand. Children that have pre-existing issues, that have been removed from the parents, that have lived in the chaos of substance use environment in their home, may be particularly vulnerable. And they're going to have grief and probably some of the relocation stress syndrome. Parents and caregivers can take steps to help children cope with those events. Some of the most common behaviors seen in children that have had traumatic or grief experiences: increased clinginess, increased crying, greater than usual fear of separation from the parent, more withdrawn parent or caregiver, more withdrawn, quiet, etc. Changes in sleeping with your little ones. This is how a lot of little ones show. Changes in sleeping, eating, and toilet patterns. Babies wake up more frequently at night, and a lot of that's because they feel the stress of the caregiver. Toddlers may act out scary events that they've seen. Children may return to earlier behaviors. Not just a toddler take up thumb sucking, but a 5- and 6-year-old may return to that. I had a great-granddaughter that did that. I think one of the things we need to be aware of is, I just pulled this off a few days ago. CDC reports, following the adjustments for delayed reporting, that the predicted number of drug overdose deaths showed an increase of 0.5% from the 12 months ending in December 2021 to the 12 months ending in December 2022. It's gone up. It's not gone down. Many of these people with overdose have children that are left behind. Johns Hopkins Medicine, this again was one of their new postings. Drug overdose death stigma is a serious issue that can prevent people from seeking help and support. So if you're a caregiver and you have a child, you may be struggling with seeking help and support to get through that grief process. What are you doing for the children? They said it's important to recognize that SUDS is a disease, not a moral failing, and that people who struggle with addiction need compassion and understanding. How do we deal with that? Because stigma is a major issue. Children in school, and they have a parent that overdoses, and word gets around, and other children don't really understand what that means, but they know it was something that was whispered about and talked about. Duh. We have to respect people's environment. Ways to address drug overdose death stigma. And this was in an article that was talking about for children. Use first-person language when talking about addiction. Refer to people, and again, this is from Johns Hopkins, as people with substance use disorder rather than addicts or junkies. Absolutely. First language helps to reduce the stigma associated with addiction. It emphasizes that people with substance use disorder are human beings who deserve respect and dignity. We all can help that happen, and we have to help our littles go through that. This is Children's Grief Awareness Month, and I thought it was so fitting that we talk about this, looking at that. And it's dedicated to addressing unique needs of grieving children and youth. You know, we're talking about up through our teenagers as we approach the holiday season. Children's Grief Awareness Month arrives at a time when many bereaved families and children are facing the holidays without their loved ones, or without the income to celebrate it, without being able to do their traditions. That's another reason we're wanting to address traditions as we get into this month in December. Yes, we expect traditions and rituals all year round, and our children will miss those. That's something you feel a sense of loss or grief over. I have, because a lot of my family rituals and traditions aren't there anymore due to circumstances out of my control. Helping children cope, keep them in regular routines, notice emotional states, and give words or explain feelings, offer safe ways to express feelings, be patient and calm when a child is clingy, whiny, or aggressive, answer questions according to their level of understanding, create times to have fun together so that they have hope, know when to get help, and remember sometimes it takes quiet time together. It just may be sitting down and putting your arm around them, and you don't have to say anything. Here's some resources. Sesame Street in Communities has all these resources. Go on that website. They have resources for about anything that impacts a child's life, including substance use disorder that Jerry Moe coordinates, and we're going to be having him do a webinar for us later this spring. Here's a good book, Grief Doodling. It's good for adults and children. This lady, this just came out, wrote a book about grandparents raising grandchildren. She addresses a lot of issues around grief and loss in it. This is an example of some of the things that she has in there that just help you get through the worst of it and can help children that are old enough to understand. CDC has this, helping children during and after a disaster. It also addresses issues around death, and it has age appropriate. I know we're running out of time, but I want to make sure these get up here. SAMHSA has this too. It's I believe it's a 4 or 5 page document that breaks it down into different ages. If this was a 2-hour, we'd be doing pretty good. Remember, November's Gratitude Month. Help our littles and our older littles feel and share gratitude. Let them know you are grateful for them and your time together, and hug them when it's safe and appropriate. That helps them get through the grief. I want to thank you. I hope this helps. There is a survey that will pop up, and I would appreciate it if you would do it. Join us for our traditions and rituals, either in November or December. Anything that you might find around these issues that you want to make sure I include as we move forward at different times when we do grief, I would love it. Thank you all. I'm going to send you to the survey, and I hope you have a great week.